we've had to make some really uncomfortable calls. And you mentioned earlier how things are so rapidly evolving. I mean, last Thursday, which seems like a long time ago because it's 7 days later now, but I woke up and was just checking through my messages and just looking at the news, and I always check some of the medical. I love to read about medical history, medical journals, and things of that nature, and just because it became very worrisome signals how cases went from 50 to 1,000, and seemingly very quickly, right? And so I began to feel like we need to prioritize now. We need to keep people healthy now. We need to think about delivering care differently now, and we need to shut or pivot or 180 now. So I gave my team the directive of, look, we have 18 clinics sprinkled throughout the community in a number of different locations, and I said we need to stop seeing patients face to face, right? And to keep that in perspective, we do about almost 2,300 visits each business day across all those areas face to face.
Yeah.
So to turn that off was
major impact.
Yeah, like a major adverse impact,
sure.
frankly, right?
Yeah.
And so,
just from a business standpoint, but also for the community, they're used to going in and seeing their doctor.
Yeah,
and
then for the 160 physicians or so, they're used to coming to their clinic and seeing their 15, 20, how many ever patients they see. So this is a very different thing, and I had to tell them, we're going to wind down face-to-face visits as of whatever this Friday. Report to your normal clinic on Monday. You're going to get education on how to do a telephone visit, as a bridge, and then you're going to do video visits 3 or 4 days later, right? And everyone's going to do this at the same time. Yeah. so everyone was on this WebEx. A bunch of doctors and nurse practitioners and et cetera on this WebEx learning how to do these types of visits, right? Because they had less things to do because it wasn't safe to see the patients face to face. And I think, so that we had to pivot within a matter of days. And these are workflows normally that take months to perfect.
Yeah.
Right.
There's a major organizational change in how you.
And there's a technology integration piece that's not simple.
Yeah.
And and then some of these physicians and APPs ultimately will be delivering this care in the safety of their own home.
Yeah.
Right. So that's another thing with their care team, the people they're used to bumping into and say, hey, can you help me with this or that? They're not going to have that. So So it was a big organizational lift. So that's one thing we did. We turned off the face to face. We turned on telephone and virtual video visits on a dime. We prioritized some of our clinics to be the sick patient clinics, where we could see patients with respiratory syndrome, right? We really think it's important to protect the hospital, right? You can't say going to the ER is not the answer right now. Yeah. We really got to keep that place is for those people that only really need to be there. And the ER could get very easily overwhelmed. So that's one thing we did, open up the sick clinics. Yeah. And then the last thing I think that's really important that we did is we started to think about our pools of predominantly ambulatory physicians historically that could help in the hospital if necessary. And that's for the nurse practitioners, PAs, and the physicians. So we have physicians that are trained as internal medicine physicians and maybe haven't done as much hospital medicine in the last few years because they've been more outpatient focused, but sort of on a volunteer basis say, if you guys need me, we'll back up our hospitalists. Yeah. Our pulmonologists are saying, because a lot of them trained as critical care physicians, they're saying, hey, we're on deck to back up our intensivists. Yeah. We know unfortunately, healthcare workers are going to get exposed. Some of them might develop symptoms of the disease, and then they have to have some sort of self-quarantine process, so that team would be out for a bit. Yeah. And I just hate to read those stories of emergency room physicians or intensive care physicians get this from patients, and then,
Well, we're seeing that already in New York and other, markets like, as you mentioned, Seattle and San Francisco. I mean, it happens quickly in the domino effect. This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.